Bangladesh is a very challenging place to work, but it's never boring, and anybody who tries it will find it a very worthwhile experience. Well, my name is Dr. Felicity Mussell. I'm an obstetrician and gynecologist, and I've just retired from Lamb Hospital after 13 years there. It's a very busy place. On the maternity side, which I work in, we deliver about 3,500 babies a year. We have a lot of very complicated cases because many of the patients have not had antenatal care, and they arrive at the hospital with all sorts of complications which we try and sort out. We train Bangladeshi doctors in obstetrics and gynecology, and also in pediatrics and medicine. We are always looking for more doctors and indeed nurses and other paramedical workers because it is very busy. Quite often we have members of staff who leave for to work with other NGOs or with government service, and sometimes leave very suddenly, and then we have a lot of gaps in the staffing. So we're always looking for more people to come and work with us. Essentially because I believe it's what God wanted me to do, and it has certainly taught me to rely on Him when I certainly don't have the resources, the ability to cope with the difficult situations. So I have to ask Him for the strength that is needed. And also it's been very good working with both Bangladeshi and expatriate staff and seeing the results of good teamwork. We have medical students who come for electives, usually for about 2 months, 2 to 3 months, and that's tremendously valuable, particularly for them to see the sort of work that is done and perhaps consider whether they would come and work longer in the future. As for professionals who've already got qualifications and experience, we can often have people, say for 3 months or so, but certainly 6 months to a year is more helpful, because then people get to understand the local situation, learn more of the language, and if people can stay for several years, that's even better. Well, I would encourage them to pray and see if they believe that's what the Lord is calling them to. I would encourage them to talk with people who have maybe worked in a similar situation, and then I would say get in touch with Interserve, or in our case with LAM, and see what can be done.